The challenges for palliative care are many. We're an ageing society, we've got an ageing workforce, and our nuclear families are not what they were. People are working to older age and we don't have the carers for them. We're going to see more people with cancer and more people with chronic disease such as heart failure, with severe lung disease, and increasingly dementia and frailty. So how do we help to look after those people? I'm a palliative care physician and I work down at Flinders Medical Centre and Southern Adelaide Palliative Services. I also help to run the motor neurone disease clinic down there for South Australia, and of late have become the co-lead for the Statewide Palliative Care Network with the Commission on Excellence in Innovation and Health. The CEIH has been quite innovative of itself because this is the first time they've actually ever had co-leads. I think it brings that balance to really looking after patients, patient-centred care. Our consumers are so important, but they often get forgotten in the journey with their ill health.
This type of co-leadership model really works well for innovation of ideas. And this is the first time that a consumer has actually held the position of a co-lead here in South Australia. We're wanting to be involved in decision making that affects our health. So we're wanting to actually be involved in the process of healing ourselves. We want to know where to go for information. We want to feel empowered in the process of healthcare delivery.
What has been completed in the last 12 months is the Statewide Palliative Care Framework, and underneath all of those is a number of strategic issues that we wish to address. Models of care. How do we look after everyone with the resources that we've got? We need to think differently. Sustainability for staffing is significant, and we need to be preparing and planning now for the next 10 and 20 years. One of the other topics that will come out of the framework is also bereavement. It's an area that is so important to help our bereaved family members and friends move on after the death of a loved one.
It's actually getting the information out to people that is really the next area to be worked on. Where do people go for information? And that involves their general practitioners as well, community health, because they're sometimes the first point of call for people, and it's actually having that information available to them.
The infrastructure that's set up in this environment where the goal is to challenge, is to innovate, is to change, is quite a refreshing approach to care. And by collaborating with other disciplines and the multidisciplinary nature of our network, I'm hoping that we can make change.